All right. Hi, everyone. I'm Jenny. So I work as a nurse practitioner at the Gold Coast University Hospital. I've been here approximately 10 years now, so the time's gone very quick since I've started. And I work closely with the neurologist here at the hospital to try and assists with the management of patients with motor neurone disease. So I thought today, we could talk about a bit of medication use and as well as sort of symptom management. I find, that a lot of people sometimes, struggle with managing symptoms, and so I hope I'm able to assist as much as I can in that way. So I'm happy for anyone to contact me at all. My email address is up there. I'm happy to take questions at, any time. You can email me, any questions after this talk, and I'm happy to, respond as much as I can, okay, to try and help you. So we might start. Here we go. All right. So as you are aware, MND, with the patients with MND, the symptoms are varied. So everyone presents in a different way. And the reason this is that, we have these sort of upper motor neurons and these lower motor neurons. So, what they do is cause different signs and different sort of symptoms depending on, what you have been diagnosed. So the most common form is ALS. And so with ALS, that you do have the combination of both upper motor neurons and lower motor neurons. But some, people with the progressive, lateral sclerosis usually just have the upper motor neurons, whereas someone with the flail arm type or the bulbar onset type will have the lower motor neurons. So it depends on your diagnosis and your what your symptoms will be. But hopefully we'll cover some of these symptoms that occur with people today. So some of the symptoms directly attributed to MND. So I'm aware that you have lots of different symptoms, but some are caused by MND and others are sort of related to, complications associated with MND. So if we look at things like, your motor symptoms, so, your muscle weakness, the fasciculations, those tiny little movements that you see under your skin, they're called the fasciculations, cramps, spasticity, problems with breathing, problems with swallow, problems with speaking. And of course, not everyone gets these symptoms, okay? So each person is individual and may have some of these symptoms or may have all of these symptoms. There's a lot of information coming out recently in regards to cognition, and they've found that some people do have some sort of apathy or impaired decision making. So, other people, around you might, describe that this is what's happening for you. It may not necessarily you see it yourself. And the pseudobulbar effect, so that's, that laughing and crying that sometimes occur for some unknown reason. And that's all due to, motor neurone disease. But the indirect ones, this is the ones that we concentrate a lot on in regards to management of symptoms, and and that includes pain, and pain can be due to a number of different factors that we'll go into. The immobility, just because you can't support your limbs due to the muscle weakness can also cause some pain, particularly, in your shoulders, in that area. Headaches, swelling of your feet or your hands that can occur, and that can, create pain as well. Secretion. So, I'm sure a lot of you know that, secretions are a big problem. So, you can get sort of drooling, or those thin secretions, the thick secretions as well, a lot of nasal congestion, or some people just have a dry mouth. And so, we'll cover some of this area as well. And the gastrointestinal problems, the constipation or the weight loss, some people get GORD as well, so sort of more indigestion type of symptoms as well, and fatigue and coughing as well. So these are the symptoms that are, not part of MND sort of thing, caused by MND, but they're sort of indirectly, affected. So what our principles of care is, we look at a multidisciplinary approach, to, address, and the physical, psychological, social, and the spiritual care of people. We try and enhance quality of life and, provide relief from the symptoms. But of course, we call it patient-centered care. So the patient is always in the centre of our care, and sort of we revolve around you in regards to what your needs are. So the multidisciplinary team, approach is important, and each hospital does that differently. Here at the Gold Coast University Hospital, we run things a little bit differently than compared to, say, the Royal Brisbane Hospital, where you have a MND clinic where you come in and see a lot of the specialists at one time. Here, I'm a big supporter of, us, the patient being the centre of the care. And so, I believe that, a lot of the times we should go to you at your home, and, or, having that care close to a centre that's near you as well. So we run things a little bit different here at the Gold Coast in that regards. But they show that multidisciplinary care can improve your quality of life and survival up to 7 to 24 months. So it's important to, make sure that, looking at your care, that you do have this team around you. So I'll cover some of the, what we call the neuroprotection medication. And at the moment, you are aware that in Australia, the TGA, which rules the release of medications in Australia, has only approved Riluzole or Rilutec as medication that we can use for people with motor neurone disease. So this is available, in tablet and liquid form. And the clinical trials showed that the survival benefit was approximately 3 to 6 months. But they say that it's probably more beneficial in the early years of diagnosis rather than the later years. Unfortunately, with every medication, there is adverse effects, so side effects. Every medication unfortunately does side effects. And so that's why, it's important to have the blood tests done, and it's, it should be done every month for the first 3 months, and then at least every 3 to 4 months after that. So if you're on Riluzole, making sure that your GP is doing regular blood tests for you, just to check on your liver. Okay, because this can affect your liver, but if it shows that your liver function tests are raised, then it's just a matter of stopping this medication, and your liver results always return back to normal. Other adverse effects of the Riluzole as well is fatigue. And also it can cause some nausea as well. So, it's important, I know it states on the information for Riluzole to have it not at mealtime, but you know, this unfortunately does cause people to feel nauseous sometimes. So I believe if it is feeling nauseous, taking it at meal times, you know, I encourage that if that's easier for you to take. I also start Rizol at a lower level. So, you know, I believe in taking it, you know, at a once a day to start with for a couple of weeks, you know, before you take it twice a day. I think this, you know, all medications I think should be started low and gradually sort of introduced just to try and prevent some of these side effects from happening. So if we look at things like respiratory management, you know, it's important to monitor your respiratory function regularly, you know, with the lung function studies. But there's other things that we can use besides medication to manage your respiratory function. You know, I'm a big believer in creating breeze. So, you know, if you have some shortness of breath, you know, just having sort of a slight fan going to create that breeze, or the window open slightly, things like that, just to, you know, get that air sort of thing just blowing past you. And it's best if it blows past you rather than directly at your face. I understand that you have had I think in one of these education sessions, I think someone from Respiratory has talked, so they may have covered some of these things as well. But it's worthwhile reviewing, you know, all these hints sometimes. Breath stacking as well. Hopefully the physio has talked to you about breath stacking and the importance of, you know, having those deep breaths and pushing that diaphragm down, you know, as much as possible, and doing this at least once a day. You know, breathing is part of an exercise that you should be doing along with, you know, some of the other sort of more motor physio exercises that you do. The use of BiPAP as well. So the trials have showed that it can extend your survival for up to 13 months. So it's important to have this recognised, that if the respiratory specialists believe that you may benefit from, you know, BiPAP or CPAP, then, you know, it's worthwhile giving it a trial to see whether it will benefit you. And it often improves your fatigue levels as well. The cough assist machine is another thing. They are unfortunately very expensive machines and not available for everyone. But you know, if some people find them beneficial in regards to using, you know, once or twice a day if they have a weak cough, just to, you know, to be able to clear the respiratory tract, so that helps prevent any infections at all. Some of the, if we go on to some of the medications that we use to manage respiratory function, is we often use medication called Ordine. So that is an opiate or a morphine derivative, and it can be used to help control shortness of breath and anxiety associated with that. So it's sometimes, you know, recommended to take, for example, before showering or before meals, if that at that time sort of thing you feel that you get short of breath and get a bit anxious, you know, before that happens. So once again, you know, it's about starting with a low dose and, you know, increasing gradually as required, with consulting your doctor, of course, with that. Benzodiazepines, so they're things like lorazepam and clonazepam and midazolam, things like that, and they're very good at also controlling anxiety. And, you know, once again, you know, start with very low doses and, you know, and increase as required. One of the benefits of some of these medications is Ordine is a liquid, so it's much easier to swallow or put through the peg if needed. Lorazepam can come as a wafer, so it basically dissolves in your mouth. And clonazepam can come in drops as well, so it's something that's easy to take. Important reminder, if you are taking any opiates at all, so these things for morphine, for example, Ordine or Endone or any of those that you might be prescribed, it's important to manage your bowels as well, because these can cause constipation. So anytime, you know, you start with some of these medications, just be aware that you might have to start or increase the amount of medication that you're using to assist with your bowels as well. The saliva, I probably spent probably half of my working life managing saliva. It always seems to be one of those difficult things. And to try and get it right, you know, is so hard. So the watery saliva, that drooling that can occur, you know, is usually due to either swallow problems, or is it due to, or can also be due to weakness in your face muscles, and so that you're not holding that saliva in your mouth as easily, and that's where you get the drooling from. So often we use, you know, anticholinergic medications, and this is something, for example, amitriptyline or NDEP, they also call it, and that helps reduce and thicken the saliva. The trouble with, you know, once again, there's side effects to every medication. So amitriptyline can cause you to feel sleepy. And so a lot of the times we only use it at night time, because, you know, it will help you sleep better, as well as reducing that saliva overnight for you. Some people find that it reduces their saliva too much, and so they end up with a dry mouth and don't like that feeling either. So it's a really matter of sort of balancing how much medication you need and, you know, when to take it as well. Other things for the watery saliva, you know, can be buscopan. So, you know, it works quite effectively as well. Sometimes what we have to do is basically use a couple of these or combinations, or one thing might work for a while and then it won't work, and then we have to try something else. So sometimes we do use a bit of a combination of things. The glycopyrrolate, you know, this is sometimes available in the oral form, but we have to apply to the TGA to get the oral form of this. So a lot of the times we use it as a subcutaneous injection to help with management of saliva. Botox as well, into the saliva glands. It does work effectively with reducing that watery saliva, but it only works for about 4 weeks. And then you have to have it again. So, and what happens sometimes, it causes a lot of dryness as well. And so a lot of people think I'd prefer just to put up with it when, rather than continue having the Botox. But it is an individual thing, definitely, in regards to whether people tolerate that or not. Beautiful. Okay, so, you know, radiation as well, you know, I have seen that used in the past as well, but, you know, I haven't seen it used very successfully, and it unfortunately did cause a bit of pain with the lady that I seen it being used with as well. But you may have, you know, had different experiences in this area. Having a suction unit at home is quite useful as well, you know, for those times that, you know, you've got a bit of overload of saliva in your mouth. It's good to, you know, have a good clear out using a suction unit. Just around your mouth, don't put it down your throat, because, you know, it can irritate your mucosa even more, which produces even more saliva. So it's important to just be gentle about it. And of course, diligent mouth care. I always talk about mouth care, mouth care, mouth care every time when I see my patients. And, you know, it's so important, you know, to making sure that every little bit of food is removed from your mouth after meals, you know, that you know, definitely, you know, clean your mouth out, you know, several times a day. You know, sodium bicarb is one of the best things that you can use, you know, for mouth care. The thick saliva as well, so check your fluid intake. You know, that's number one, you know, making sure you're not dehydrated and that's what's causing the thick saliva. Or you're talking too much like me and so that you get a dry mouth and things like that. So, you know, it's important to, you know, making sure that, you know, your fluid intake is good. Other things you can use, you know, papaya enzyme is great for breaking down that saliva. Sipping juices or having ice cubes of, you know, the dark grape juice, apple juice, papaya and pineapple. You know, swabbing the mouth regularly with the bicarb soda and things. You know, these are all things that can help with that thick saliva. You know, nebulized saline, salty water is fantastic, you know, to helps break down that thickness in the saliva as well. And once again, you know, the suction unit, the mouth care, so important to, you know, continue to with your mouth cares. Dry mouth, you know, often this is related to mouth breathing during sleep. You know, when you've got weakened muscles in your jaw and your face, you know, then your chin may drop at night time, and so that you will have, I think, oh, you're right. Sorry. And you can get a dry mouth. So, you know, it's important once again to make sure that you're well hydrated, sipping fluids frequently. And then we've got all these sort of oral lubricants that you can use as well. So, you know, things like biotin and, you know, and I recommend grapeseed oils. You know, it's something that a lot of people just have in their pantry. You know, rub that onto the insides of your gums before you go to bed at night time. And I find that, you know, that works quite well during the night. One of the problems with having dry mouth is that it can create thrush. So just important to keep an eye, okay, on your mouth care. You know, if you feel that you're developing some thrush, then, you know, get some Nilstat or see your GP, you know, about looking after that as well. Uncontrolled coughing. So with MND, your larynx can go into a spasm as well, which can cause, you know, this, you know, feeling of discomfort and coughing, and feels that, you know, that you're choking on this. So sometimes what it is that, you know, if you take big deep breaths sort of thing, and as much as you can sort of thing, that can relieve that sometimes. But sometimes people find that they do need, you know, some morphine or Ordine or even clonazepam drops just to relieve that sort of discomfort from that sort of laryngospasm that does occur. Nutritional support as well, so important to keep an eye on your weight loss. You know, malnutrition does exert a negative effect on survival, and weight loss can occur for a number of different reasons. You know, we know that some people with MND have this hyper metabolic state that occurs, and, you know, some of you might be in the research program in Brisbane, you know, looking at that. Swallow problems as well, and also, you know, feeding difficulties, you know, so you know, if you have a loss of limb function with your arms, then, you know, feeding is quite difficult as well, sort of thing, and you may take in less food if you're relying on someone to feed you. It's important to have early involvement by a dietitian. and also to, you know, recognize, you know, sort of early nutritional requirements that the dietitian sort of may recommend. So whether that's increasing protein, increasing calories in your food, increasing fiber, things like that are important. And of course, you know, the timely insertion of PEG or the RIG tubes, you know, this can also assist with preventing, you know, weight loss and malnutrition associated with MND.
Jenny, could you just check if there's somebody in the weight room again now, please?
Mm-hmm. I can't see anyone. Is there someone there?
I've got somebody having a bit of a problem, but not to worry if you keep going.
Do you know who that would be, or?
No, not at the moment. I'll see if I can sort it out. Sorry to interrupt you again.
Oh, hang on. Yep, no, there is. Yeah. Hang on. Yep.
Great. Thank you.
I think I've got them all. I should be better at this, shouldn't I? Sorry, everyone, for leaving you in the waiting room. I'm just not used to these little chores that I have to do. Constipation. So, you know, that's, you know, it's, if any of my patients are listening, and I know some of you are, that, you know, it's the things I talk about all the time, you know, the things that will get you hospitalized, you know, and I tell all my patients that my job is to keep you out of hospital. And so constipation, unfortunately, is one of those things that I see so frequently that people have to come to ED for. Okay, so it's important to keep on top of constipation, you know, and even if you've never suffered from constipation for your whole life, you know, because of changes of diet, or, you know, you're getting less exercise, things like that, you know, all those things have an impact on your bowel. So important to, you know, fluid intake. You know, I keep talking about fluid intake all the time, making sure you're hydrated and things. Increase your fiber. You know, work with the dietitian to make sure you've got enough fiber in your diet. Pear juice. Pear juice is an amazing thing that that you should have, you know, in your fridge, in your pantry, all the time, sort of thing. You know, I think it's one of the best natural cures of constipation that there is. You know, I've got a new little granddaughter, and I feed her pear juice as well. And of course, you know, review the drug. Review the adverse effects of drugs as well. So the medication that you're having may also be affecting your bowels. So things like, I think we got someone. I haven't muted someone. Here we go. So things like amitriptyline, for example, you know, it can cause constipation, the NDEP. So, you know, just be aware of what medications you're taking and whether they're having an effect on your bowels as well. You know, of course, and as I've said before, the Ordine, you know, in particular, the morphine, opiates. So there's tablets for bowel control work in different ways. So we have those that are softeners. So if your stool is hard, you know, things like Coloxal tablets or lactulose syrup, they help soften your bowel motion, okay? But if you find that your bowel motion is soft, but it's really hard to get it out, sort of thing, you know, that your bowel is fairly slow and sluggish and things like that. Things like, you know, Senna and Dulcolax, things like that, that's how it works. So sometimes you have a bit of a combination, you know, so you can have Coloxal and Senna tablets. And so they'll work in combination to try and fix both the things. Movicol as well works quite well too. So, you know, so there's things that you can swallow a little bit more easier. Movicol is, you know, in liquid form, so that might be a little bit easier to swallow. The lactulose is in liquid form. You know, Dulcolax you can get in liquid form as well. You know, so some of these things are easy put through the peg or to swallow easy as well. And, you know, if there is some problems in regards to weak muscles as well, you know, in your bottom, then, you know, suppositories or even microlax enemas might be something that you need to do. And of course, it's important to be aware that, you know, if you've got diarrhea, it doesn't necessarily mean that, you know, you've got gastro or your bowels are working really well and things like that. This could be due to, you know, sometimes when you're constipated, you get what's called overflow, so that you do get diarrhea associated with constipation. So it's important to, you know, be aware of that and keep an eye on that if necessary. Mood disorders as well, you know, there is a number of medications that we can give in regards to helping resolve that as much as we can. But, you know, the important things is making sure that you do have that support around you. You know, support groups like these are fantastic, you know, in able to, you know, discuss information and also, you know, if necessary, get some you know, psychological support or, you know, talking to a counsellor as well. But, you know, sometimes these medications will take the edge off some of those, you know, if you're having some concerns, you know, with either depression or even, you know, with the labile moods and things like that sort of thing. You know, sometimes these, just a small amount can help in a lot of ways. Pain. So pain is, MND doesn't cause pain, but, you know, it's all those things associated with having MND that can cause pain. So, you know, things like muscle cramps, you know, overuse of certain joints because, you know, your muscles aren't as strong as they used to be. So you're relying more on your shoulders, for examples, things like that sort of thing. You know, if your arm is weak, you know, once again, you know, your arms may hang more and you haven't got that muscle support around your shoulders, so your, you know, your shoulders do get painful, unfortunately. Swelling as well can cause you know, pain in your feet or your hands as well. So, you know, it's a matter of looking at those sorts of things to see what we can you know, manage. You know, things like physiotherapy is important, hydrotherapy, you know, it's fantastic, you know, getting you off that sort of, you know, having that less resistance, you know, in water and things like that is fantastic for your joints. Repositioning, so it might be a matter of putting your arms onto cushions when you're sitting on a chair, which will support your shoulders much better than just having them lying in your lap. Pressure cushions and mattresses for your beds and for your chairs and things like that, important things to have to try and prevent pain. But there's also different pains that are managed in different ways as well. So all that muscle pain, those aches, general aches and pains and things like that, that's where we use, you know, paracetamol or Panadol or the Nurofen, things like that, you know, and sometimes we even use a combination of both of those, you know, that can be quite useful to controlling that pain. And sometimes if you know that you do regularly get pain, it's also important that you take some Panadol before you experience the pain. For example, you know you're going to be out, you know, for a few hours at an appointment or something like that, and you know every time you go out for a few hours that you might experience some pain, you know, in your bottom or in your arms and things like that. Maybe, you know, take some, you know, Panadol or Nurofen before you head out, you know, because it works more effectively in preventing pain rather than trying to stop the pain once you have it. The neuropathic pain as well. So this is when you get those sort of sharp nerve pains that sometimes radiate from your shoulder and you know, or go down your legs, things like that. So, you know, things like gabapentin or pregabalin, which is Lyrica, they might be of benefit and work quite effectively on this type of pain. For cramps, you know, things like trying some magnesium or even, you know, tonic water as well. And they seem to work quite well with managing pain a lot of the times. But, you know, physio, stretching out, things like that, you know, I definitely sort of agree that, you know, these are probably the first things that you should try. So the spasticity, so this is mainly for those people that do have the upper motor neurone symptoms. So, you know, muscle relaxants, we often use muscle relaxants. So things like baclofen or clonazepam work quite well. And once again, it's about starting slow and increasing as necessary to try and, you know, manage the symptoms. But once again, physiotherapy, hydrotherapy, important things. That's why it's important to have making sure that you've got a physiotherapist on your team, you know, to try and, you know, relieve some of these symptoms. So this is basically just a bit of an overview of, you know, all the things that, you know, I did discuss sort of thing with you sort of thing to try and, you know, relieve some of these symptoms and things like that. And I won't go through all them again, but we'll talk about, you know, one of the things we need to talk about is medication review. So I think, you know, as we age, we start to build up a lot of medications that we use, and because of, you know, multiple sort of different health problems that we do have, you know, including things like statins or to reduce your cholesterol levels, you know, blood pressure medication. You know, you might be on some aspirin or some blood thinners, all these sorts of things, you know, they sort of start piling up on each other all the time. I think it's important to review these medications regularly, and particularly, you know, when you have MND, you know, you want to review them for a number of reasons. You know, over time, you might find that your blood pressure is no longer a problem, that you're not getting those, you know, high blood pressure anymore. So it's important that the GP is regularly checking your blood pressure and reviewing your medication as you go along. Statins for reducing your cholesterol levels, it might be something that you might want to, you know, not take anymore either, you know, because this is preventing, you know, long-term complications, and statins can also cause muscle aches and pains and things like that as well. So important to, you know, keep reviewing these medications all the time. You know, looking at the risk versus the benefit sort of thing associated with these medications. So this is what we call de-prescribing. And even, you know, medication like Ridazole, you know, it works the best, you know, in the early Oh, sorry, my alarm's going to go off in a minute. Sorry about this. We had to put a pause for a minute.
Patricia Knight, please present to main inquiry desk on ground level.
So these things come at the microphone all the time.
Personnel, we are trying to locate Patricia Knight. Please present to main inquiry desk on ground level.
Sounds like someone's gotten lost in the hospital. So remember, you know, every time you go see the GP, ask whether, do I need to still be on this medication? You know, what are the adverse effects of this medication? You know, and, you know, you might find that some of the adverse effects of your medication is, you know, a symptom, and you don't want another medication to relieve the adverse of medications, and particularly if it's just the, you know, the medication just needs reviewing. So that's, I think we're just about up to time now. So, you know, I love this saying by Stephen Hawking, you know, in regards to, you know, don't be disabled in spirit as well as physical wise, you know, it's about never giving up. So, you know, I'm happy to answer any of your questions, and you know, and as I said before, my email is there if you later on, you know, after this or at any time in the future, if you want to just email me some questions, I'm quite happy to answer you. Not a problem at all.
Thank you. Jenny, are you done?
Yes, I'm done.
Brilliant. So do we have any questions for Jenny? Can't see anyone other than you at the moment. Could you, let's unmute everyone, that might help.
How do I unmute everyone?
I think I need to if you've muted yourself, I can't unmute you, but everyone else, if you wanted to, yeah, if anyone wants to ask any questions, then please go ahead and do so now.
Okay, I've got a question for Jenny.
Yes.
Jenny, I have been suffering from nausea
Mm-hmm.
for about 18 months now, and I've tried a variety of medications, you know,
Yeah.
ones that help you empty your stomach,
Yes.
ones that interfere with your serotonin,
Yes.
and ones that are sort of anti-emetic, and none of them seem to touch it. The best thing I've found is actually dry ginger ale or ginger beer.
Okay. Yes. Yes.
I just wondered if there was something else you could suggest.
Yeah, because, you know, we often try, you know, the things, as you say, you know, the Maxilon and things like that, which helps empty your stomach a lot quicker and things like that. You know, but, you know, you're right in regards to, you know, some of those natural products work quite well. They do, you know, so, you know, you can get, you know, ginger, you know, anything sort of thing, you know, but, you know, I think, you know, sometimes that bubbly, you know, ginger ale works quite well, you know, with that, because it's the bubbles sometimes help things as well.
Yes, to sort of calm you down a bit.
Yeah, yeah. You know, other than, you know, it sounds like you've tried, you know, everything possible sort of thing.
I'm up here in Caloundra, and they've
Yes.
just started an MND clinic at the local hospital.
Oh, great. Yeah.
So I met with them a few weeks back now, and it's in the palliative care part of the hospital. So I met with the palliative care doctor,
Right.
and we talked about using cannabis oil with THC, which she has tried with some patients.
Yep.
But I don't like messing with my mind, so we didn't go down that path.
Right. So they felt that the THC would be benefit the nausea rather than the CBD?
They said the two together is what they would suggest.
Okay,
but
yeah.
Of course, it takes you on a little trip.
Yes, 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 that's right. So
and
we
if you
have
don't like that. Mm.
Yeah, because we've got our trial going here at the moment, but it's mainly CBD rather than THC, so it doesn't have that effect on people at all.
Right.
Yeah, so it's but the results of that trial haven't come out yet, so to see whether it does have an impact on nausea or not at the moment. So
Yeah.
interesting to see, I think. Yeah.
So that's meant, besides losing muscle, I've just not been eating well. And so I take 2 times resource per day, the meal supplement.
Yes.
So it adds about 1,000 calories and hopefully some micronutrients.
Yes. And that's
And
on
that's
top
helped
of,
a lot. On
yes,
top of trying to
on
eat 3
top of
meals.
it. Yep,
Yeah.
yep. And you have a dietitian as part of that MND clinic as well?
No, I've got the My Aged Care finally through.
Okay.
And so a dietitian comes to see me,
Mm-hmm.
which is very helpful.
Okay, great. Yeah, yeah, good. So if anyone else has sort of, any recommendations for Peter in regards to helping with nausea, I'm open to listen to what your suggestions are. Sometimes I get a lot of ideas from people like you in regards to what you use and what helps and things like that, and I always add it to my little list of hints and things like that. I love listening to people's stories and what has benefited them. Any other questions?
I have resource 2, but I take it via a pen. Now I find if I put it down undiluted, it makes me feel sick. So, but the problem is if you've got to take it by mouth, I dilute the resource 2, so it's only 1/3 of the strength. So it's more like the strength of normal milk.
Okay. It doesn't bloat you too much at all?
Well, no, I'm used to it. So, now the other question I've got, I was on glycopyrrolate at one stage, and that caused urinary retention. So
yeah,
I've had to stop it, but I was then put on Flomax for an alpha blocker for the urinary retention. The problem is that it only comes in a sustained or controlled release form, and the only way I can take it is by crushing it up.
yes.
And there seems, I can't even find any information about what the effect of that is. I mean, I suspect that I have all the effect in the first part of the day and none of the effect later on.
Well, I'd assume that would probably be the case, definitely. And, and hopefully, because sometimes they're in the suspended form as well to protect your stomach as well. So I'd have to look up that medication to see whether, it does have any effect on your stomach as well, having that. There's no alternative that they've thought of to give you?
There is an alternative, but its side effect profile is worse than Flomax.
Right. Yeah.
So they're reluctant to try that.
Yeah. It's so unfortunate, that sometimes the side effects to medications is worse than what you're taking them for, isn't it? So hopefully, hopefully we'll get on top of these things one day.
Right, any other questions for Jenny? No?
If I'm happy to, talk, if there's any topics that you want to discuss and things like that you're interested in, I'm happy, send me an email or get in contact with Stacey, if it's something that we can help you with, sort of thing. I'm not sure, Stacey, whether you've got a list of topics that people are interested in at the moment, or
Yeah, we've asked that question a couple of times, but it is a great question, and we continue to ask it. If anyone thinks of something that they'd like us to organise a speaker in relation to a particular topic, then just send us a message, and we'll make sure that we find the best person to present on that subject. We're very keen to grow the library of webinars so that you've got access to information about anything that you might need at any point in time. So yeah, feel free to get in touch. Look, I wanted to say thanks again, Jenny. I personally found that really, really informative. I think it would be great to be able to point our clients to the recording of this presentation. But if anyone thinks of any other questions after the event, like Jenny said, she's given you her email address, or you can get in touch with us and we will pass on those questions as well. Make sure you get the answers that you need. Okay?
That's good. Thank you very much.
It's been great to see so many faces, including some new faces. So I hope we get to see you at support groups in future.
Okay.
Thank you. Bye-bye.